Hello, today I'd like to talk to you about FIV. Your cat's been diagnosed with FIV. What do? Unfortunately, for many of you, you've heard that you should probably put the cat to sleep as it poses a risk to your other cats and maybe the neighborhood cats as a whole. What we've learned here at Delta Rescue is that that's not necessarily what you need to do. We have very successfully managed cats with FIV for long periods of time. For a cat to actually die with the FIV virus, it requires them to develop the immunodeficiency problem where they actually become sick. Being a carrier does not necessarily mean illness. Now, there are certain precautions that you need to do. Here at Delta Rescue, these animals are segregated. We keep FIV cats together with other FIV cats. You can't pose a risk to others. However, in a home situation, you can certainly do this by segregating cats to given rooms. It is not a disease that is carried through the air. You can successfully manage these cats, good nutritional support, early treatment for any secondary infections if they do develop the immunodeficiency aspect of the disease, and homeopathic support. You need to ask your veterinarian for your options. If your veterinarian gives no options, you need to seek another veterinarian, ask other people who they've used and have successfully managed their cats with FIV. FIV does not have to be an immediate death sentence. Quality and quantity of life go hand in hand. If you have any questions about this illness, please contact me at deltarescue.tv. Click on Ask the Vet, and I'll be more than happy to get to your specific question. Hello, today I'd like to talk to you about West Nile virus. I'd like to help set the record straight on exactly what this virus is and how it's contracted. The disease is spread by the bite of a mosquito that picked up the virus from a bird. It is not spread by infected mammals that are bitten by mosquitoes. Mammals are what's called an end reservoir or an end host. The disease is best controlled as opposed to treated. What we have found here at Delta Rescue is that preventing mosquito breeding areas by not allowing standing water, treating your pets and horses to prevent flies and mosquito bites is your #1 protection. For horses, there is a vaccine for West Nile virus. To date, there are no vaccines for people, dogs, or cats. West Nile virus, although there is no specific treatment, can be treated with supportive care as with any other viral disease. Indeed, the majority of dogs, cats, and horses that contract the illness do not die. They can be treated and supported through this illness. The best offense is a defense. Get rid of standing water, mosquito prevention, vaccinate your horses. But if you do get a diagnosis of West Nile virus, by all means, treat the animal. You do not have to euthanize it. If you have specific questions regarding West Nile virus, please contact me at deltarescue.tv. Click on the Ask a Vet button, and I'll be glad to get to your specific questions. Hello, today I'd like to talk to you about cancer. What do you do when your pet has been diagnosed with cancer? Unfortunately, for many, it means putting their pet to sleep. Well, what I've learned here at Delta Rescue is that that's not a necessary option. Here at Delta Rescue, we treat many animals very successfully and extend both their quality and quantity of life. The important thing to remember is that a diagnosis of cancer does not mean an immediate euthanasia. We've found that by using surgery, chemotherapy, and various homeopathic support treatments, that we are able to control and extend an animal's life. We here at Delta believe that quality of life is all important, and we watch very closely for signs that the animal is comfortable. We use appetite as one of the major determining factors. If your animal is eating and wanting to live, then we feel that we owe that animal an opportunity to go on. What do you need to do if your veterinarian feels like that euthanasia is the answer? Always seek a second opinion. You need to go to other people, find out where they've gone to have their animal treated, and decide if that's the best option for you. We know that the advances in veterinary medicine and some of the things that we've done here at Delta Rescue, that you can very successfully treat these animals and give them a good quality of life. If you have any further questions, please contact me at deltarescue.tv. Click on Ask the Vet, and I'll be glad to get to your specific questions. These are definitely ticks, as opposed to stick-tight fleas. These are fleas, isn't it?
And then they just throw them out when they're done.
Well, you know, I mean, I was just thinking about how people think that they're going to put domestic animals out in the wild and expect them just to assimilate into the wild population. They're healthy otherwise. And, you know, and as pale as they look and as loaded with parasites, we should get a CBC on both these right away, Johnny, as well. They've been living a pretty miserable life, it looks like. Kidding.
Where they were, they could have come out. They could have come out from high up. They could have migrated down the stream from deer country.
Yes, because these are deer ticks here. These little tiny ones.
Yeah. They've been on the trail.
Yeah, little guys.
I know, sweetie. I'm being careful. Hang on. Nephew.
Get these cats.
Not one dog.
They're out in more.
No.
Huh?
No. We'll recover from this. The campers have left, and nobody's feeding these cats, so this is the time of year that I come in and trap them and take them to the shelter, because otherwise, in fact, if I wait too much longer and the rains come, they get sick. Hey, little guy. Somewhere in here is a gray and white kitty, perfectly camouflaged. I think it's time for me to set out the traps. Yep, he sees it. He's got to go back and get it now. One more step. Got him, right there. Okay. Now what I have to do here is, after I've got the last one, I got to lay all the traps out for about an hour and sit on them. The worst thing is to leave just one all by himself. I take all the cats to our hospital where they're examined and blood tested, dipped for parasites and vaccinated. Then they go down to our isolation ward for a couple of weeks till we know they're okay. Later we spay and neuter them, release them into one of our 30 catteries. And all the cats from one rescue area go into the same cattery so they could live out their lives with their friends and relatives. Who's on me? Somebody's sucking my neck. Who's that? Hi. Come here, baby.
Well, in this litter of parvo pups, their white blood cell counts are starting to rise. We have one pup that seems to have had a little relapse and is dipping back down. I'm not certain how real of a relapse this is, and just that we've been propping up the white blood cell count with the fresh whole blood transfusions, and that's kind of holding that up. We tried to back off of that a little bit, and this white count dropped down to 2,000, which is kind of getting close to the threshold where we want to start giving blood again.
So I took 2 litters home once when they got it, and I did all of this treatment at home. And I brought them out in the sun, and I nursed them and did the whole thing. But of 17 puppies, I had 17 survivors. I caught it early. I knew right away that they were getting it. And these guys came in, they were already, you know, full of symptoms. They were vomiting and diarrhea. I had it like 3-4 days before that would start. So when you get it early, you have a better chance. And there's something about the, you know, their will. They're smelling fresh air and sunshine as opposed to being, you know, smelling death.
That's what it is. Intensive nursing care. You know, you got 5 puppies that are having constant vomiting, diarrhea, pain medication, vomit medication, IV infusion, blood every 6 hours, testing their blood, keeping them warm, you know, just everything. And you just don't stop. But it's worth it. And this girl cried every time I left the room. She'd scream for me until I came back in. She's my girl.